Tonight in Niagara Falls, MPP Wayne Gates hosted a healthcare town hall. The event allowed the public and a panel of healthcare providers to weigh in on the state of healthcare in Niagara.
Well, I think what I learned is that the residents of Niagara, because there was people not just from Niagara Falls in my riding of Niagara Lake and Fort Erie, is that people are very passionate about healthcare, that they care about a publicly delivered, publicly funded healthcare system.
The strain on the health system is being felt on all sides, from paramedics to ER doctors to nurses.
Obviously, offload delays keeping ambulances tied up at hospitals directly affects our ability to respond, especially if call volumes are starting to become higher and higher, and we're stuck at hospitals longer and longer. There's an increased need for staff, there's an increased need for resources, and it's the patients that are suffering, really. Paramedics are professionals, we're very adaptable to things, but it does take its toll. Mentally and physically, being able to have to stand there for hours and hours and provide care to patients.
The floor in the waiting room in my ER is filled with homeless patients because there's nowhere for them to go. I see patients with falls, with bleeding in their head and a spinal fracture in a chair. My patients admitted to hospital will be on a ER stretcher for up to 5 days. My trauma victims with broken bones and various injuries will be on an ER stretcher for 3 days. How it came to pass in our province with relative wealth and resources, it came to be this is unconscionable.
The event provided an opportunity for attendees to listen and learn, but at the end of the day, participants voiced a common theme: the need for more funding.
We need the funding. We need to make sure that if there's beds available in the hospital, we have the staff, we have the funding. And then obviously all that package goes together. Bill 124, the attack against nurses and healthcare workers and paramedics and correction officers, all that has to be taken care of.
So number one for us, being a community service, is we need some more funding. A lot of that funding that comes to the province doesn't make it down to the grassroots organizations. It goes to the hospitals, the region, the schools, and us as a smaller organization aren't seeing that funding. And one of those things, if we get that increased funding, we can alleviate some of the stress on the hospitals because we can offer those extra services that don't always come with the hospital and hopefully decrease some of those hospital visits and emergency room visits.
Not every decision by the Ford government's bad. But what I would encourage the government to strongly consider is how to better fund public institutions, because that's where the vast majority of care is, and that's where I see really the dignity of average Ontarians being compromised.
Most important thing tonight was Niagara Health was here. People from mental health were here that weren't on the panel, but they wanted to be here. And I've said to Niagara Health many, many times, you got to get back out in the public. You got to talk to the public. You got to let them know where we're heading when it comes to healthcare for the residents of Niagara. And for them being here today, at least they're here to listen to some of the concerns, listen to the panelists, and in some cases their employees, quite frankly, who are saying we need help, we need more. And I think it was good that Niagara Health heard that.
In Niagara Falls, reporting for The Source, I'm Mitchell Glass.